Your belly fat, general weight gain, bloating, and other devastating menopausal symptoms are not just a result of your decreasing hormones, despite what you have been told. The ultimate solution to not just alleviating your symptoms, but banishing them permanently lies through tackling this insulin resistance head on. And now we have a powerful aid to back us up, GLP-1 medications, but we have to pair them with proper lifestyle interventions. While the decline in those important sex hormones is wreaking havoc in your body, contributing to symptoms like stubborn belly fat and a decline in your overall quality of life, the true power lies in understanding the key tenets of metabolic health that we're about to go over in this video. My name is Dr. Jones, and I own clinics that service across the nation. I work with medical practitioners, and we help our patients achieve lasting weight loss. And I've been doing lasting weight loss for the last 20 years. And in the clinical setting, I work with these women's health practitioners. So bioidentical hormone replacement therapy, dealing with women in menopause is something that I'm all too familiar with. And even though this video is not about hormone therapy, I'm a big fan of it. It truthfully isn't the key to handling the belly fat. In fact, I think of my mom because, she was actually the reason I got into bioidentical hormone replacement therapy about a decade ago when she started struggling with her menopausal symptoms and did some research and we ended up putting her on BHRT therapy. And, we haven't looked back since. And, for her and me, it's been massively improvement for me and my brain fog. But this is belly fat, right? And it's always frustrating when I see clinics selling BHRT therapy, which again is powerful for so many symptoms, can aid and support that belly fat loss and overall fat loss. But really, it's a small contributing factor. And we're going to get into all that. Truthfully, I want you guys to really understand now. You're already thinking, because I've mentioned it, insulin resistance. How does all this play together? Let's start by talking about what is menopause. So menopause is a condition that affects women. Essentially, it's the end of the ability to give birth, right? And so we diagnose this, medically speaking, it's been about a year since your last period. That's the official diagnosis of menopause. But really what's going on is a massive decrease in the production of their sex hormones, the big ones being estrogen and progesterone. There's also a decline in testosterone, although testosterone's been declining for decades before menopause, but specifically with menopause, a massive and marked decrease in estrogen and progesterone. And menopause, it's so fascinating. And at the same time, it's horrible what women have to go through. In fact, when you think about the last 30 years, women have literally had to suffer. The damn Women's Health Initiative trials came out and basically scared the shit out of doctors and women alike, drawing very inaccurate conclusions and making it to appear that hormone therapy is actually dangerous, when in fact it's dangerous to not give women the hormones that they need. Estrogen, progesterone playing vital roles in so many different categories of health and life. So I love that we've hit this threshold now and we understand that that information was completely wrong, completely inaccurate, and women need it. Thank God there's always been providers. I mean, we've been doing this for the last 10 years, despite the fact that it wasn't until very recently that they finally came out and said we were wrong. But anyways, whether that was intentional or not, that's for another time or place. We're here to talk about belly fat and what exactly is going on. So many things are contributing to the dreaded belly fat. And one, we have estrogen, right? So estrogen in a woman is responsible for the distribution of fat, right? The areas of which the body fat it lays out, right? You look at just the difference between a man and a woman, right? Men tend to gain excessive levels of body fat in the stomach, in that abdominal area, and women tend to put it on in their butt and hips. This is via the action of estrogen. Estrogen is that femininity, that potent separation between a male and female is the increased levels of estrogen. And you can say for males to females, it's the increased levels of testosterone. But understand, both genders have both hormones. It's just the amounts we're talking about. So the increased levels of estrogen are responsible for this distribution of fat and giving women this curvy figure, right? But as we've said, menopause brings upon us a decrease in estrogen. Therefore, there is a change in the distribution. Now, the belly fat is going to be an area that will now start to put on body fat because we don't have the pattern, the estrogen telling us to put it on, telling women to store it over their hips and their thighs. And so therefore it stores on the belly. Now, we have a better understanding over the last 10 years in metabolic health, understanding the roles of fat, specifically visceral fat. There's two types of body fat, visceral and subcutaneous, in terms of where the body fat is stored. Subcutaneous underneath the skin, visceral fat is around, in that central adiposity, because it affects the function of your organs. We now know how devastating visceral fat is, especially compared to subcutaneous fat. I mean, you can almost say subcutaneous fat isn't even a problem, although it is. It's still pro-inflammatory. But visceral fat is really what we see being the hallmark and the centerpiece of the metabolic syndrome, the path towards diabetes, obesity, autoimmune diseases, various medical conditions, that all of which, by the way, have this difficulty losing weight, whether it's belly fat or not. So belly fat will drive this resistance, right? This insulin resistance. And we're going to talk a lot about insulin resistance later, but you've heard of it. And the effect of insulin resistance is chronically elevated insulin levels. Truthfully, when we look upstream of a lot of these issues, right, the fat and the inability for your body to lose the body fat and keep it off, it's insulin resistance. And when you look at the basis of obesity, I argue that chronically elevated insulin levels are the true culprit behind obesity, the true culprit behind diabetes and many other health conditions for that matter. So getting the insulin resistance under control is going to be the most important thing that you must do if you're looking to handle your belly fat. Getting your hormones optimized are a powerful secondary thing, and I think really is just a completely different set of problems, right? If you're suffering from your night sweats and your hot flashes and your energy and your anxiety and your depression, all that, get your hormones. It'll even spill over a little bit to the fat, but your hormones will actually get better to a certain degree by just getting your body fat levels down, by getting your insulin resistance under control. So if we had to choose one of those categories, unless a woman is specifically complaining of those symptoms that we talked about and it's ruining the quality of her life, usually it's starting with the fat, not just the belly fat, but although we mentioned the visceral fat, the belly fat is the worst kind, just really getting the metabolic health improved and focusing on the proper lifestyle strategies to accomplish just that. Many things can actually contribute to as well, in addition to issues with insulin resistance, even thyroid. And I mentioned this because we're talking about hormone therapy, and thyroid management is sort of its own kind of piece of the equation here. When we look at hormones, thyroid is the master hormone. There are trillions of cells in the human body, and each cell actually has a receptor for thyroid. So I consider, and many practitioners agree, thyroid is actually even master to how powerful testosterone, estrogen, and progesterone can be. Every single cell has a receptor for thyroid. Thyroid hormone activates these batteries in our cells called mitochondria. And it's those batteries that actually convert the very broken down substrates of the food that we eat into the energy that we actually utilize, ATP. So very, very important, thyroid. And having suboptimal levels of thyroid will exacerbate your weight and cause you to gain weight easier, make it much more difficult to lose weight because you're burning fewer calories, and that plays a role as well, because burning less calories, more body fat, more insulin, more insulin resistance, and more insulin resistance goes back to why your belly fat is stuck and why you're trying, or maybe you even tried hormone therapy and you feel better, but your belly fat's not moving. You see how this all plays into a very intricate set of various hormones. And truthfully, there's harmony when you have many of these things optimized. So your hormone therapy will always go smoother if you focus on dropping body fat and improving your insulin resistance, and your insulin resistance will get better faster if your other hormones are optimized. So truthfully, doing them both at the same time can make a huge difference. We talked about bioidentical hormone replacement therapy, which, like, what that actually is replacing, right? We talked about what it looks like and what it can do, but what it actually is replacing the hormones in your body with bioequivalent, bioidentical hormones that match the ones in our body. And that's why the literature was all screwed up, because these synthetic versions, you should stay the hell away from. Those are dangerous, like Prem-Pro and Premarin, but bioidentical are very safe and can and will make dramatic improvements in your quality of life. But what is really going to fix the insulin resistance? What is going to actually move the needle in terms of getting the resistance fixed? We need to talk about that, because, like I said, not even BHRT therapy is going to override the need for you to do this if you are desiring to lose that belly fat and keep it off for the rest of your life. And high amounts of insulin resistance can actually interfere with your hormone therapy. I see this happen time and time again because when you're insulin resistant, you have higher levels of inflammation, and the pairing of both of that, the inflammation can actually and does actually impact the metabolization pathways of these various hormones. And a lot of the effect that we get from hormones isn't just the three hormones in this particular scenario, estrogen, progesterone, testosterone, but it's also the downstream metabolites. Your hormones are constantly being converted in one direction or another through multiple different pathways to provide us with other hormones that we need for other processes, if you will, within these same categories, right? So it's very, very important, and high amounts of inflammation can interfere with that, and it does in many cases. So what's up with insulin resistance? Like we gotta talk about this. We gotta understand this much more in depth because there's a massive lack of information about this. Medical practitioners do not test for insulin resistance. It's crazy because before you became pre-diabetic, before you got that diagnosis, you were battling with insulin resistance for about 3 to 6 years on average. Can you imagine what you would have done or what you could have done had you known that this entire process has been going on for that long? But you weren't. And it's one of the reasons why I'm on such a mission to spread this information out there. So in order to understand insulin resistance, you got to understand insulin again. So insulin is not just your blood sugar regulator, although that is one of its primary functions. Truthfully, what its main function is to do is storing. It's a storage hormone, right? So because how do we regulate blood sugar? We store it. Well, it doesn't just store sugar, carbohydrates. It also is responsible for storing fat tissue, and it's also storing the breakdown of protein, which is amino acids. Insulin is the most anabolic hormone in the body. You have to let that sink in for a little bit. Bodybuilders will actually inject insulin in an attempt to build more muscle mass, knowing how dangerous it is because a little extra insulin can kill you. And people who are not doing it regularly, non-diabetics, this is a problem, right? It's much easier for a non-diabetic to overdose on insulin because they're much more sensitive to it. Anybody can OD from insulin, but yeah, non-diabetics injecting insulin, that's a huge, potentially lethal situation. Yet bodybuilders will still do that. All the other crap they take, none of it's going to kill them in a single situation, but insulin very well can. But they still do it because insulin is that anabolic. And I want you guys to understand that, because there's still people out there that'll tell you it doesn't matter about hormones. It just matters about calories. And I have so many other videos that you guys need to check out on my YouTube page where I get into all the differences between the basis of obesity and the battle between calories and hormones. And I'll let you guys dive into those when you're ready. But truthfully, insulin is a powerful signaling hormone. Like most hormones, they're signaling, but specifically what this hormone is signaling is storage. It wants your body to store. It wants to grow because you need a store in order to grow, right? And we know excessive growth leads to cancer. We know excessive growth is one of the contributing factors to various malignancies and various cancers. And so while there's many complex components to that, high amounts of insulin can actually, and we do know, has the contributing factors to drive towards that. So we don't want to have too much insulin, yet we're still in this situation where people are confused, right? And they think it's all about calories. But let me put it to you this way. Yes, you have to be in a caloric surplus to gain weight. Yes, you have to be in a caloric deficit to lose weight. We know this. But being in a caloric deficit when you have chronically elevated insulin levels, right, is a very different scenario than being in the same caloric deficit and having chronically lower insulin levels. That's the piece that most people do not understand. Now, we have data that shows, and this is where it gets really confusing, we have data that shows us that, well, the fat loss that we were able to observe in that situation, the exact same situation that I laid out for you, the fat loss is the same. But those studies were only done over a given period of time. And that insulin, that signal of trying to get your body to store, you have to zoom out of the study, right? In those studies, calories were controlled for, meaning they put these people in a metabolic ward and they were able to observe and enforce the amount of calories. Well, guess what? Outside of a metabolic ward, out in the real world, What dictates how much you eat? Yes, to a certain extent, your conscious decision. I'm going to eat this much or I'm not going to eat that much. Yeah, we all have willpower. But my God, if willpower was that good, I don't think we'd be in the freaking problems that we're in to begin with, right? Most people don't have willpower, and enough mental toughness, right? We become victim of our hunger, right? We can't choose how many calories our body burns at rest. And that's the unfortunate part of trying to take those studies, which many people are inaccurately doing, and trying to extrapolate that to real life, which does not the same. So plenty of other videos that get into that. So bringing it back, we have a deep understanding of what insulin does. Powerful storage hormone. Insulin resistance is a condition in which your body is no longer responding as well, as effectively to insulin. So let's just say, for the sake of simplicity, you eat 100 grams of carbohydrates. It takes 100 units of insulin to get the job done. Well, when you become resistant, you eat the same amount of carbohydrates. Now it takes 120, and then it takes 140, then it takes 160, and then 200. And literally, your body is having to produce more and more insulin to get the same amount of work done, right? That's what insulin resistance is. Now, what's causing the insulin resistance is quite fascinating. There's many different schools of thought, and there's many ideas behind this. But what I have seen to be true for the last 20 years, because this is what I focus on and I see people get better, is chronically elevated insulin levels. Now, definitely we know saturated fat in high amounts. We know inflammation plays a big role. Chronic stress with cortisol, toxicity. We're not negating any of this. But a lot of those things, you can only do so much about them, especially the genetic component, right? You can't do anything about that. Some of these forever chemicals are with you forever. But what we can control is the insulin resistance, because the resistance of, the chronically elevated insulin levels, right? That's creating the resistance. That's a lifestyle thing, right? What is it in our lifestyle that's creating insulin, right? What causes the secretion of insulin? We've already talked about it. It's very simple. It's when you eat. There's 3 sources of calories. There's carbohydrates, protein, and fat. Carbohydrates has the highest, hands down, the highest amount of insulin secretion. Protein has moderate, low, and fat is almost none, negligible, right? When within the carbohydrate, you can even expand that, having healthy carbohydrates on the lower side of this range, and all the way to processed, high sugary foods having the highest secretion of insulin. So it's what you're eating, folks. It's what you're eating. So what is the best form of not eating carbohydrates? And we're going to get into all that here in a second. Okay, so before we get into all that, though, like, what do we do here, right? Like, how do we beat this, right? This is a tough battle. This is not an easy thing at all, right? Because where I'm alluding to is you got to eat less carbohydrates. You got to do lots of fasting, right? You got to reduce your inflammation levels. You got to get in a good supplement protocol. You got to handle your stress. You got to optimize your sleep. I mean, there's so many pieces to this. So this is why I'm such a fan of GLP-1 medications like semaglutide and tirzepatide, and why I think they're a must, because there's this barrier for not just menopausal women, although for menopausal women, it's a big thing, but PCOS, obesity, diabetes, autoimmune conditions, just high amounts of insulin resistance, even if it hasn't progressed. There's this insatiable hunger, right? That's the hallmark classic sign of insulin resistance. And it's kind of funny and sad at the same time, right? Because these individuals have all this body fat, but they can't tap into the body fat because they're insulin resistant, right? So their body keeps storing, and their body thinks they're hungry because they don't have energy readily to burn. They're very poor on the metabolic flexibility side of things. So their body wants to eat more because it doesn't think it has the energy. It has a difficult time accessing energy, because the chronically elevated insulin levels not only put you in storage mode, but it also inhibits lipolysis. Chronically elevated insulin levels also block the mobilization of free fatty acids. This is a huge problem. There's many, many things that we need to do. We need to fix the insulin resistance. We need to lower inflammation levels. We need to become fat adapted. But ultimately, the most important out of all that is just lowering the chronically elevated insulin levels, which are going to happen when you do those 3 things. When you become more insulin sensitive, when you reduce inflammation, and you become more fat adapted. Well, it takes a tremendous amount of lifestyle interventions to do that. with and without the GLP-1s. And this is where it gets a little confusing because GLP-1 medications will immediately make an individual more insulin sensitive. It'll immediately reduce that resistance, and it also reduces inflammation, and it also shuts down food chatter, which makes it easier for people to eat better, right? One of the categories that we talked about is the whole nutritional piece of it, right? Eating less processed foods. In order to do that, the benefit of the medication is that right there. To me is it's hard to say what's more important. They're both freaking important, the insulin resistance and the food chatter. But the food chatter is huge, and you need to make that change in order to start the healing process. Right? The body is an amazing machine that's always trying to heal, but it can only heal through blocks till it can't. And the food that you're putting in your body, the highly processed, inflammatory, chemical-riddled crap that tastes so goddamn delicious. And trust me, I get it. Remember, I was overweight myself. If you didn't know this, if it's your first time here, I was an obese teenager, late children years, and then teenage years. I lost 100 pounds, and it wasn't a smooth journey for me. I struggled for over a decade after that to maintain my weight. I yo-yo constantly, just like many of you. And it took me 10 more years of this struggle of yo-yoing to figure out that if I just lower my chronically elevated insulin levels, and I did it via mostly fasting, to be completely frank with you, lots of heavy fasting, which we're going to talk about, and other pieces too as well. It wasn't until I did that I was able to maintain a healthy weight. And now I maintain a very lean physique year round, because I still do a lot of those things. I just tweak them here and there. And, I have a lot of other videos talking about going beyond healthy to the lean and ripped physique, just with lots of fasting and good lifestyle choices. So the semaglutide, the tirzepatide, even tesofensine, and I have videos on that one too as well. If you can't get your hands on GLP-1s, tesofensine is our favorite backup option for suppressing hunger. You get on this medication, you get your cloud lifted, if you will, and you can think more clearly. Now you're making better choices. Well, guess what? Now it's time to get to work. What are the tenets here? What are the things that I think are going to make the biggest difference for long-term lasting weight loss? Because remember, you can just take these meds and a lot of you are just going to lose the weight. That's it. But I promise you this, if you don't get these lifestyle choices in, some of you might not even lose the weight that you want to lose, but some of you will. But all of you, damn near all of you, are going to regain all that weight back, because truthfully, there's underlying mechanisms driving that propensity to regain, and the medications give you that short-term effect. But when you stop, you have to have something to replace the effect of the medications, and that's the lifestyle. So getting into nutrition, this is plain and simple. You got to eat less processed foods. You got to reduce the toxicity. So eating less processed foods is up there. That's number one. And then in the same category of nutrition, eating less carbohydrates. Now, we call that the ketogenic diet. Mind you, I'm not saying we need to go keto for life, because I don't do that either. And I don't think it's sustainable. Everything that I'm recommending, that I preach to, because I have coaching programs. We coach globally, and we have thousands of people in our community that have successfully weaned off these meds. I think what makes the most difference is focusing on sustainability. That to me, because what's the point of doing something that if you can't sustain it? So ketogenic diets aren't sustainable, but I do recommend like a good 2 to 4 month period in the beginning, alongside eating less processed foods. Okay, great. So we got the nutrition side of things. Fasting, I think and this is probably the most controversial lifestyle intervention that I preach, because I don't think intermittent fasting anymore is controversial, but what I've created is the FLOA protocol, FLOA, fasting like our ancestors. This is my structured approach towards prolonged fasting. I created structure where structure was missing. Essentially, what we do over time is we start off with intermittent fasting, and we get our patients to work into weekly long rounds of fasting, somewhere up to 36 to 48 hours every single week. I know you might be thinking, holy crap, Dr. Jones, you sound like a madman. 48 hours, but this is where the science comes in. Tirzepatide makes it so much easier. the combination, and we haven't even talked about this, but we like the combination of powerful fat mobilizing peptides like AOD 9604 or other growth hormone secretagogues like CJC 1295, samorelin, tesamorelin. Combination of both the mobilization and the appetite suppression really does make it easier for most individuals to get into this long fast. And whether you argue the calorie basis of obesity, the energy balance, or the hormonal basis, guess what? This takes care of both. You do a 48-hour fast every single week, you're going to be in a great weekly caloric deficit, and you're going to optimize your hormones to the nth degree. There is no lifestyle intervention that's going to fix those broken receptors who are so damn resistant to insulin because they've been bombarded and blasted for so long than a 48-hour fast every single week. That's not for life, but that's just while we have the excessive amounts of fat on our body. The next thing we do is we need to move heavy shit, guys. I don't care, man, woman, gender, whatever, gender fluid, like whatever it is, you need to lift weights. This isn't a gender thing. This is a health thing. And you need to lift heavy weights. Despite what you may think, there's so much research now confirming how important muscle mass is. And Dr. Gabrielle Leon says it beautifully. Muscle mass is the organ of longevity. It straight up is. And it does so much for your body besides just give you the strength, which is a big deal, right? But it soaks up the glucose. It soaks up the sugar that we consume. And building more muscle mass makes you more insulin sensitive. Making you more insulin sensitive allows you to build more muscle mass. There's so much. And the longevity component, the metabolic health component, it's the currency of our metabolism. And we need that muscle mass on our body. And the problem with GLP-1s, because they suppress appetite so much, is if you're not lifting heavy weights, if you're not consuming adequate protein, then you're going to have a great degree of muscle mass loss. So lift and move heavy shit. Consume adequate protein. I forgot to mention that should have been in the first category, but a simple formula for protein is between your current weight and your target weight in grams of protein. I like that range. So if you weigh 200 pounds and you should weigh 150, your target consumption should be between 150 and 200 grams of protein every single day. Okay. Addressing inflammation. This is huge especially if you have an autoimmune disease. If you have an autoimmune disease, then I think you should be looking to low-dose naltrexone. Very, very popular in the anti-aging space. Many of you haven't heard of low-dose naltrexone, but it is a game changer for modulating the immune system and reducing levels of inflammation. And inflammation in its own right will inhibit and impair the fat loss, just like insulin resistance does, but in its own pathway. So we got to get control of the inflammation. And I think LDN is a very powerful piece. And then there's many other things like the diet is going to reduce inflammation, and the supplements, which we're about to talk about next. A good supplement protocol. Getting into a rhythm of taking your supplements in the morning, taking them in the evening. I have these awesome pill containers that make it easy. I like to keep things simple, guys. Most human beings should be taking the following: magnesium, essential fatty acids, a good vitamin D product, and a good broad spectrum multivitamin. Now, for the magnesium, probably 150 to 200 milligrams. Glycinate is great. I like magnesium threonate as well. I like 1 gram to 2 of high quality fish oil because I want to get about 1 gram of EPA, DHA, which are the essential fatty acids that our body needs. And then about 5,000 IUs of vitamin D. And then some sort of multivitamin greens product does great. And if you have that autoimmune disease, then adding some curcumin, which is essentially turmeric, but a good potent curcumin and resveratrol product, is the most potent anti-inflammatory supplement combination that I'm aware of, and most people in the functional space are as well too. Okay, so we get our nutrition down, we get our exercise, which is specifically lifting heavy weights, right? We get the fasting down, we got our supplements. Finally, but certainly not least, getting control of our stress and getting control of our sleep, because you can get wrecked by either category. Having chronic stress in your life will derail your success, throw your cortisol out of rhythm. Essentially, cortisol spikes when you don't want them, which is after the morning. And so there's some great adaptogenic herbs that you can take, like holy basil, panic ginseng, ashwagandha. But really getting in some stress management techniques, I think, are crucial. And there's so many of them out there. Breath work, mindfulness, journaling, drawing, meditation. There's all these stress management techniques. Just pick one. My favorite has always been breath work, and I do that closer to bed. I don't do it every day, but I try to do it as much as I possibly can. And then optimizing your sleep. Please check out my video on YouTube on sleep. It was posted in the last like 6 weeks, I believe. And if you saw, Dr. Andrew Huberman just did a series of 6 episodes, each 3 hours long on sleep. I even added stuff that he forgot to mention there, but consolidated 15 hours of the most recent science-backed information that's available out there to optimize your sleep. So please check that video out. But sleep is insanely important. Not only do we keep our cortisol levels in control by getting quality sleep, but not having quality sleep throws off our hormones, throws off our satiety, makes us crave more processed, sugary crap. It really does cause a whole cascade of unwanted processes. There's no magic, guys. There's no magic bullet. I know we're all hoping one day that science is going to advance to a point where there's this magic bullet, this magic shot or pill that has no side effects, causes instantaneous weight loss and health achievement, and there's no downside, right? I mean, who knows? Maybe we'll be alive for that crazy invention one day, but I would still be wary of anything like that because God knows what kind of long-term side effects might happen from that. But in any case, I think being grounded with your perspectives, and I don't think anybody's arguing that it's the best scenario is taking a bunch of medications. Like generally speaking, I think most people get it that, look, I'm on these meds because I need them, right? If you have erratic blood pressure, take the blood pressure meds. If you have erratic cholesterol, blood sugar, take those meds on the short term. But what if we added to that? Okay, great. I'm on these meds. I need them for the short term, but let me continue to work on my lifestyle 3 months, 6 months, 12 months later. Why is the narrative always so centered around, I need these medications for the rest of my life? I think if you start to flip that narrative, when you're looking at this particular issue we're talking about here today, which is menopausal induced belly fat, but just really the big picture, guys, I will continue to do my best to help you to the best of my ability, but it starts with you. I can't stress that enough. And these lifestyle strategies are paramount for optimal health. If you guys enjoyed this video, if you felt like it was very informative in terms of helping you achieve your desired goals and higher levels of health, then definitely check out this video, GLP-1 Realities. This one is a interview where I discuss just our whole approach towards lasting weight loss, utilizing these meds. I think you'll find it very informative. Take care, and we'll see you guys later.